Hi, my name's Erin Topalian. I'm a psychiatric mental health nurse practitioner, and I'm also a doctorate of nursing practice student at Old Dominion University, and I'm excited to be here at Matrix. Um, the title of my poster is Evaluating the Outcomes from an Academic Practice Partnership COVID-19 Call Center. So the background is that the COVID-19 pandemic created a lot of challenges in the pediatric population, specifically access to care. And there is a local hospital here in Norfolk, a children's hospital called the Children's Hospital of the King's Daughter. And they were overwhelmed with parents calling in to the PCP and urgent care with questions, and they were unable to keep up with the demand. It was unknown whether this COVID community call center would alleviate the number of calls coming into the clinics, decrease the number of patients arriving at the clinics and urgent care for testing, and demonstrate financial savings in salaries to the hospital. So the purpose was to evaluate the outcomes of the newly developed academic practice partnership between CHKD and ODU in response to the hospital's need. So the data was analyzed related to the call volume, the types of calls that were taken, the impact to the primary care providers and the urgent care, and the savings to the hospital. In addition, the data from the study may be used to create additional academic practice partnerships between the university and the hospital. So this was a retrospective study. So the project was done, the call center was lifted, the DNP students from ODU were used across 4 states. There were 34 students and faculty that ran the call center, and they were trained online, and they took the calls from their homes. 749 calls were taken between November of 2020 and March 2021. And so the outcome was that the reason for the calls was primarily COVID-19 suspected or diagnosis and testing questions. That's why the parents were calling for the patients. There was a difference in the reason for the calls related to ages. So parents with kids ages like 7 to 11 called for, the most they called for was vaccine questions, because that's when the time period when the vaccine was allowed for that age. So they were calling with questions about safety and access to vaccines. So the students and faculty who answered the phone had resources available so they could point the parents in the right direction with the Virginia Department of Health to say, this is where you can get this vaccine for this age group, and help them maneuver and help them find appointments and make their appointments. So the study demonstrated that the academic practice partnerships effectiveness in leveraging the student faculty provided care, and the students contributed to understanding the outcome related to the call center. The study outcomes can serve as a template for similar call centers in the future. And this call center was audio only because it had to be lifted up so quickly. But in the future, we're hoping that maybe it could be pivoted to a telehealth platform and used for something like obesity or asthma or mental health in the future. Significant findings were that only 8.8% of the patients or parents who called had a return visit to the urgent care or PCP, which means 91.2% of the callers did not, which kept them out of the urgent care and PCP, which alleviated the heavy staff burden facilities during that time. So if you have any questions, please come find me, and I will be there in person, and I'm really excited to go over more details about the project because I really enjoyed it. And Dr. Gustin, Dr. Parrott, and Jelana McCaslin worked with me, so I just wanted to say thank you to them. And that's it. Thank you.